So during an Ayurvedic consultation, the patient will come with the main symptoms, what is really bothering them at the moment. And the whole point is really to try and understand what is causing this. So we do like a little investigation, understanding when it started, what was happening then, what other symptoms are happening at the same time. We're trying to look at the medical background, any operations that may have taken place, any medication taken for long term, because sometimes the symptoms may just be a side effect of some medication. So we need to understand and differentiate it. What's the original symptom? What's the original imbalance? We look at the family background. It's really important for us to know if there are some sort of trends, genetic trends in the family in terms of imbalance. But all of this is really to understand the constitution of the person and the nature of the imbalance. We will look at symptoms as well. We'll evaluate all the elimination system. How is it functioning? Are you eliminating your feces and urine and sweat? In which quantity? Is it too much, too little? It looks wrong in terms of the quality of it. All this helps me understand the constitution and the imbalance. The other thing we will look into is the emotional state. Again, it gives information about the constitution and the imbalance. We will look at the sleep quality. We will look at the digestive capacity. We will take the pulse, and all these are helping to validate again the constitution and the nature of the imbalance. So we're getting closer to understanding what may be causing the imbalance in the first place. We'll be looking as well in depth at the diet. So when is the person eating, what they're eating, how, in what context they're eating, what drinks they're taking, how much they're taking. So all this is really important as well. And not just we're going to look at the food through the mouth input, but also the other types of food that we talked about in previous videos is the food for the eyes. How are you spending your days? What are you hearing? What are you seeing? What are you doing? How are you using your body? And is this in the right quantity according to your constitution, in the right quality according to your constitution? So that's a really interesting process that we go through in details to understand where the imbalance is taking place. And then a proper recommendation can be made in terms of diet, in terms of lifestyle, in terms of herbal remedies, and if necessary, some Ayurvedic treatments.